Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. All right, we are going for the trifecta today. So if you see anything, we are wearing the same outfits. We are trying to make chit-chat about things that we've just seen each other for 2 episodes in a row.
That's okay. Well, actually, I do have something to tell you.
Ooh, okay.
So, as Deborah says, on the TikTok, I'm sure you've seen the viral butt lifting leggings. So I ordered them. And for those of you who don't know, I have quite a large behind. Those things work. It's no joke.
Oh, yeah?
It's no
now,
joke.
how about, was it the Kardashian jeans too?
Oh, yes. The Jolene's.
Yes.
They're not butt lifting. They're just like nice. But yes, I did get those. We talked about this like literally 6 months ago. I got them, loved them, and then bought another pair in the darker color when they came back in stock. So yes.
Nice.
And I wore them on my trip to Sedona.
So you definitely go for all the trendy, cool little...
Well, and our friend Kim went on the trip to Sedona with me, and she had purchased them also. So she also gave them 5 stars.
Okay.
Yes.
All right. I maybe have to look into it.
You will. Every once in a while they go on sale. I think they're having a sale now. So
okay. Yeah, I haven't bought jeans in a while, so that's something to look into.
And they're super soft.
Yeah, well, because jeans are not comfortable typically.
Yeah, no, these are very, very soft. They don't feel like jeans.
Nice.
Yes.
I like that. Now, like because we're talking about this and our phones are listening, I'm going to have all kinds of ads for this.
Well, the butt lifting leggings, I suggest if you're trying to lift that situation without working out to make it happen, because it worked.
All right. I like that. That's cool.
Yes.
I got a booty too. So let's raise it up.
Yeah, why not? Let's raise all of our booties to the sky.
Right.
I
feel like this is like one of those Catholic songs. I will raise you up on eagle's wings.
Yes, we'll raise each cheek on eagle's wings to praise for booty lifted leggings.
All the nuns are like crying or rolling over in their graves.
There's this one nun on TikTok. I forget what her name is. Sister something, obviously, because she's a nun. She like gets down for the Lord. She does. She's twerking for Jesus out there.
My goodness. Oh, P.S. I know you haven't watched The Pit, but in season 2, episode 1,
I see all the...
I called it, and every medical professional called it. Spoiler alert, the nun has gonorrhea in her eye.
Did she get it from the father?
Supposedly not. Supposedly it's because she cleans like some shelter or something and cleans sheets. But every single medical professional saw it.
This is a meme right here.
With a bad like conjunctivitis. Like that's going to be GC or chlamydia. It's going to be one or the other.
She's got the STI in the eye.
In the eye. But everyone called it. It's hysterical. Just certain things. I was like, they've got to use that plot device. It's just right there for you.
Now, hopefully she doesn't lose her eye to it.
No. It's just antibiotics. She'll be fine.
Okay. And there's so many ways we could go on that, but I'm just going to.
Yeah, just leave it there.
Yeah. I don't want to go to hell, so I'm going to leave it there. But yes, there's a nun on TikTok who dances. There's also a priest on TikTok who's an EDM DJ. And all of his songs are like, we want peace. And it's like, they're both very cool. Yeah.
All right. Bring it to the younger generation.
Yeah, why not?
Let's do it.
The Lord likes the beats.
There you go.
Yeah.
Especially when they drop.
Yes.
And when Nicole drops it like it's hot.
Only when the beat drops do I drop it like it's hot. Got to time it correctly.
My goodness.
Wow. Okay. This is what happens when we've had
see nuns and dropping
episodes.
it like it's hot and booty lifting.
Look, you're the one who brought up the gonorrhea in the eye. I was keeping it musical. You took it elsewhere.
Speaking of musical nuts, I'm just kidding.
Goodness.
We're not
scared.
good.
I'm scared.
Oh my goodness. Well, actually, that does segue into the name of the movie that I'm covering. Something the Lord Made. Look at that. That was so unintentional. It was magical.
Seamless.
It was.
It was.
Oh my goodness. And.
Which I swear I actually didn't read your notes, so I didn't even know that.
I have overcome my fear of blue drinks.
Because you've been talking about this blue drink thing forever.
Has cured me.
Was it a fear? I don't know if it was fear.
It was a preference.
Dislike.
Yeah, but I've drank more blue drinks related to this podcast than I've ever drank in my entire life up to this point. So
I've had several blue drinks.
I have. They just happen to go with all of my topics. I don't know. My goodness.
So what is your drink today? Tell us about it.
My drink, what did I name it? The Blue Baby? Yes. The Blue Baby cocktail. Right. This one is courtesy of Chat, Mr. Chat, GPT.
Boyfriend Chat.
Yeah. So 1.5 ounces of gin, 1/2 ounce of blue curacao, 3/4 ounce of fresh lemon juice. Mine's a little less lemony. My lemon was kind of sad, and it's the only one I had.
You didn't have bottled lemon juice to supplement?
No.
Oh.
And then 1/2 ounce of simple syrup and sparkling water. So just combine everything except for the sparkling water in a shaker. Pour over fresh ice. Top with your sparkling water. I did use sparkling lime, so that'll add a little citrus I was missing from my lemon.
Nice.
Take a sip. I have not sipped it yet. That's easy. Yeah. Gin and citrus. It goes. It's nice. I like it.
Much more smooth than the Pernod.
Yeah. No anise in this one.
No.
Why? Yeah, there's some winners, there's some losers. Someone else might love it, if that's their thing.
I didn't hate it. It was just too strong. It needed like something else to balance it out for me.
Right. So the movie, Something the Lord Made, 2004, starring Mos Def.
What?
Yes.
Where has Mos been?
I don't know. There's like a handful of things I know him from. And what's the Hitchhiker's Guide to the Galaxy? Yes. That's a big one.
I mean, we know him from his rap music as well.
There's also this movie 13 Blocks, I think it's called, where he's like a prisoner and he has
13 Monkeys?
No, he has to be transported 13 blocks, but there's all these corrupt cops, and the cop who's trying to transport him runs into all the crooked cops and whatever. But in it, Mos Def has sort of like a slight speech impediment.
Fun.
It just, I don't know. Something about it cracked me up, and I just always think of him that way.
Like speech impediment, like Mike Tyson's speech impediment?
Sort of. It was like very nasally, and it was just, and like at the very end, he like sends the cop Jack, I think, a birthday cake, because he opens a bakery. Mos Def's character wanted to be a baker one day. He had aspirations of being a criminal. And so it's like his voice reading the letter that the cop opens, and it's like, "Dear Jack." I just died. Like, it wasn't even a funny movie. I just, something about him reading the letter and then it coming in his voice, and like, I don't know why.
So, anyway. Fun fact, he doesn't go by Mos Def anymore.
What is his real name?
Well, his real name, he was born Dante Terrell Smith, but currently he goes by Yasin Bey. I guess that's his Muslim name.
Oh, okay. Yeah. All right. This movie also stars Alan Rickman of many, many things fame.
Yes.
But many people will know him from
Don't say Harry Potter. He's been in so many other things. And you have to pick Harry Potter?
But that's what the people will know him
No,
from.
That's what you want. Us non-Harry Potter people are like, who? We've seen him
He's in a million things.
He's in a million things.
Die Hard.
Oh, no.
The bad guy in Die Hard.
Bad choice. Anyway, go ahead. Proceed.
And Mary Stuart Masterson is also in this. And I can't think of things she's in, but
a lot of things in the 90s.
You know who she is.
A lot of 90s movies.
Yes. So this is a movie from 2004. So like over 20 years ago, but feels like yesterday. And it's actually based on a true story, based on the story of Dr. Alfred Blalock, who's Alan Rickman, Vivien Thomas, who is played by Mos Def, and then this Dr. Helen Taussig, who's played by Mary Stuart Masterson. So it's based on all these real life people, and they keep it pretty close to the true story. So I watched the movie, I read up on the real story. I've also listened to an episode of Sawbones where they talked actually about the real story, which is another podcast that I frequently mention. So like there was a lot of different stories, and it seemed to be the movie was fairly accurate. So we're starting in Nashville, Tennessee in 1930. So pretty back in the day. Dr. Blalock hires...
I like how we've called 1975 and 1938 back in the day.
Well, they're different back in the days, you know?
So they're different distances going back. Okay.
So Dr. Blalock hires Vivien Thomas at Vanderbilt University to be like a janitor in his lab, essentially. And, you know, Vivien Thomas started helping him out with different things, participating a little bit more, sort of becoming an assistant to him over time.
Can I interrupt and ask a question? Was this the one you were going to cover last year, but then didn't? Okay. Yes. I was like, the name Vivien Thomas sounds very familiar.
Yeah, because you know what? It was very science heavy, and at the time, I felt like we needed something different. We were doing episodes together at the time, so
got it.
I felt like it was going to be too long.
Just making sure I'm not crazy.
Yeah. So this story and like their partnership spans over 30 years. So it's a nice story because you see them working together. So essentially, you know, first they start out working there, and Dr. Blalock is working on heart surgery experiments. And he's trying to figure out a way to help these babies with something called tautology of Fallot, which we will go into the details of at the end.
So they're both pediatric.
Yeah. So Vivien Thomas is not a doctor. He was a janitor. And
but I mean, like, they're both working in like a pediatric setting.
Yes. So these are congenital heart deformities, meaning your child is born with this heart deformity. It is not genetic. It is just formed in utero incorrectly, essentially. Mm-hmm. So this one particular one will go into the detail of all of the things that are wrong in it. And it's one of the most severe ones. But essentially, they're trying to figure out how we can do something to fix this. And at the time, heart surgery in itself was not really going on. It was considered like distasteful to work on the heart, or that it was, I guess it's that heart in your brain are sort of like off limits type of thing, except for if you're sticking ice picks in the brain.
I was going to say, lest we forget what we did with ice picks, which was totally cool for everyone.
Right.
Around the same time.
So, you know, basically he just became like an assistant to him, and he started using him for more things. He started listening to him because he realized he was bright and he understood just things. Like he just had really good common sense. He also was
which not everyone has.
It's true. Like he was not trained in anything, but he just had like good instincts, common sense. He also had very good hands, which in anything surgical is important. So eventually they leave Vanderbilt and they move to Johns Hopkins. And so while at Vanderbilt, Blalock was able to keep Vivien Thomas sort of as his right-hand man, it was a lot more segregated at Johns Hopkins. And so Vivien Thomas must enter through a back door. He really works without any official recognition. He's really just a silent participant in all of this. So like I said, they're tackling this problem of tetralogy of Fallot, which is a really significant heart defect. It causes cyanosis, which we learned in another episode, which is lack of oxygen and bluing of the skin, hence the blue baby cocktail. And so they're trying to find a solution. So what they do, this is sad but true, they do a lot of experiments on dogs to try and figure out how to fix this heart problem. You know, this is what they had to work with at the time. So they would take dogs from local pounds, they would create the defect, and then try and fix the defect, if that makes sense, because these dogs didn't have the defect.
So is the defect structural or functional?
It's pumps, it's pipes. I'll show you what we're going to do is we're going to go through a diagram actually, and I have that posted as well.
Okay.
But it's essentially a rerouting of pipes. So they create the defect, make the pipes wrong, and then try and figure out how to safely put it back, because you know, you could put it back in a heart that is not alive and pumping, but you need to figure out how to do that in a real person.
Which, to be said, I know there's a lot of people out there who are against animal testing, but for the context of the story, this is what was done at the time.
Right. It's what they had available. It's just what they had. So, you know, they're just trying, their dream is basically to see an infant who has this, be able to have this corrected and to grow into adulthood. So essentially, Vivien Thomas had sort of this mental breakthrough where he came up with what he believes is a technique that would work. And it was a particular suturing technique that must allow for sort of growth of the heart over time. And so they keep refining the method to get it right. So they do have their first patient in 1944, their first real child patient. Her name is Eileen Saxon, and she was 18 months old. And the way they called the procedure was, fancy words, subclavian pulmonary artery anastomosis. Anastomosis means connecting two things. Also called the Blalock-Taussig shunt. So notice Dr. Blalock is noted, and that female doctor, Dr. Taussig, is noted. Vivien Thomas is not noted in the name of that. Initially, this patient did improve, but months later did become cyanotic again. They did a second operation, but unfortunately she does not make it past her second birthday. But it does sort of show that they're on to something. In the movie, the way they do it, and I'm not sure if this is exactly in real life, but in the movie, they have the real Dr. Blalock there doing it. And because of the segregation, Vivien Thomas isn't supposed to be in the operating room with him because he has no technical position. Mm-hmm. And essentially he throws a fit and he's like, I will not do this without him. And they call him in to help and assist and essentially be a first assist because he's like, this is the guy who imagined this technique. How can I do this without him? So they made it very dramatic in the movie, which was really nice to show that, like, I don't care if I have all the credit, like, as far as the name, but I need him. He's the one who came up with this. So, Blalock performs the surgery, like we said, with Thomas sort of guiding him. And word start to spread. Families start to come to them saying, like, I heard that you guys are on to something. They're bringing their children to their center. And then surgeons worldwide start to learn this technique and it can go across the world. But, despite their close collaboration, racism is everywhere, of course, at this time. And Vivien Thomas actually has to work because he's still being paid as like a janitor assistant type thing, someone who cleans the lab. He's not being paid as a first assist in operations.
Not even like a lab tech.
Yeah. And so he ends up, Blalock, who's very famous and has all these big events and he's rich and he lives in town. Him and his wife have all these events. Vivien Thomas works as a bartender and like a server at their social events. So just to supplement his income.
Is that they're doing, or that just happens to be coincidence of he's doing that on the side and happens to be at his
it's
events?
A little of both. So even though Blalock gives him a lot of credit, he doesn't help to break down sort of the barriers for him. And so he needs money. He's like, yeah, sure. Come work at my, event and we'll pay you. But he's not helping to break down that systemic like racism. Yeah. So the big thing that happens is there's an honors banquet for Blalock in this segregated Belvedere hotel. And Vivien Thomas is not invited, even though, of course, again, it's mostly to his credit. So essentially he watches from behind a plant. He like sneaks in and watches from behind a plant as Blalock credits others and doesn't even mention him. So in person, he needs him, but he does not, like I said, help break down the barriers and really come out and say like, no, this guy's actually the one who came up with this technique.
Which it's not okay. But also I'm just thinking for him, he's a licensed medical doctor. For him to admit that someone without any medical training is scrubbing in on surgery, that's putting his career at risk.
It is. It's a complicated situation. Yeah. So initially Vivien Thomas quits after witnessing that, but then he comes back and his love for what he's doing is more important to him than recognition.
Well, and he probably doesn't have that opportunity elsewhere, even if it's behind the scenes. No one else is giving him that chance.
So it does eventually, later, I'll see if I have any years. Yes, 1976, they honorarily go back and give him an honorary doctorate. So it took from, when they started in the 1930s to the first operation in 1944 to 1976 for him to get this, this honor and showing like he's got an honorary doctorate. And now his picture is actually hung at Johns Hopkins next to Blalock's. And he went on because he lived longer. Blalock died in 1964. Thomas went on to actually teach surgeons and residents these procedures. So in the end, he is still credited, but at that pivotal time when things were new, he was not.
So when was the surgery successful? Because you said that first child, it was not.
I don't have the exact information in my notes.
I just figured maybe you had like the follow-up, and then it worked.
Yeah, I don't remember what year it actually worked, but they did refine this technique. And I'll tell you a little bit about these kids and why it needed to be done. But nowadays there's over 1.75 million heart surgeries performed in the US. So this really was launching what cardiac surgery is. Mm-hmm. So like I said, it was just distasteful to even touch the heart prior to that time.
Which is insane to me, but what else?
Yeah. So a congenital heart defect, like we said, is an abnormality of the heart's structure or the vessels that feed into or out of the heart. And that's really an early fetal growth when we're talking about things separating and growing into different structures. So it's really first trimester, very, very early. So you might nowadays identify it during an anatomy scan. So that's like that 18 to 22-ish week pregnancy scan. They will sometimes see something and then send them for a fetal echo, and they're recognizing this before birth. But at that time, until a child was born and showed symptoms, they had no clue this kid was coming out with a congenital heart defect. Well, first we'll talk broad statistics. So 1% of births have a congenital heart defect. So that's pretty low, but they do range. So a small septal defect is just that line between the two ventricles. You can have a small hole there and you might not even know it, all the way to very severe, like this tetralogy of Fallot. And then these can lead to, obviously, if we think about the heart like plumbing, right? You have a pump, some things come in, some things go out. The muscle is the pump. It's got to make things go. So if things aren't working correctly, fluid backs up in the system. You can get high pressures in certain areas. You can have something called congestive heart failure. So, it will downstream cause issues. So very, very common types we see, and I'll just yell them out because there's a lot of them. Yeah, I'm going to yell them.
Yes, like a cheer.
Aortic valve stenosis, atrial septal defect, coarctation of the aorta, complete atrioventricular canal.
I was giving you a
transposition of the great arteries, Epstein's anomaly, hypoplastic left heart syndrome, patent ductus arteriosus, pulmonary atresia or stenosis, single ventricle defects, tetralogy of Fallot, that's the one, total anomalous pulmonary venous connection, tricuspid atresia or arteriosus, and ventricle septal defect. So those are kind of all of them. But there's a few that are really major, and these are the ones I have to memorize for my boards that I'm going to take this year. So this is a good refresher. Studying. Yes, I am studying on the podcast. So of that 1% of the population that has these at birth, tetralogy of Fallot, tetralogy, 4, so there's going to be 4 things wrong, represents about 10% of those. So they're 3 to 6 per 10,000 births. And it is the most common of the cyanotic congenital heart disease. Not all of them
3 to 6, like per 10, 3 to 6,000 per 10,000.
3 to 6 total per
10,000. Okay.
Yeah, very tiny amount. And so some of these don't cause mixing of the oxygenated and deoxygenated blood. This one does. So it's considered a cyanotic congenital heart problem because it's going to have deoxygenated blood going through the system where it should be oxygenated blood. And this one is associated more with some genetic syndromes. So it's not always a genetic syndrome, but it is more common in things like Down syndrome, DeGeorge syndrome, and Goldenhar. So those are things that it might be slightly higher in those populations. All right, I'm going to look at my diagram, and I'm pretty sure I linked that in the show notes because a picture is worth 1,000 words, especially when you're dealing with the heart. So if we think about just basic anatomy, okay, we have a left side of the heart and a right side of the heart. Each of those has a top called the atrium and the bottom called the ventricle, right? They each have an in that comes in the top, and it goes from the top to the bottom, and then from the bottom goes out. Right? So each side has that whole thing, an in, through, and an out. One side, the right side of the heart, is supposed to be taking deoxygenated blood that came back from the body through your veins and then pushing it to your lungs to go get oxygenated, right? The other side, the left side, probably the more important side in most occasions, is taking that oxygenated blood and pushing it out to the whole body. So very, very, very important. All right. So we got that, right?
Mm-hmm.
Okay. So the 4 things that we're going to have wrong. 1, something called pulmonary stenosis. That is where the thing that leaves to go to the lungs, that vessel there, the pulmonary artery, that opening is thickened and narrow. So right there, things are not moving out so well to get oxygenated.
Mm-hmm.
Your right bottom of your heart, your ventricle on that side, is that wall is going to be thickened. So bigger isn't better in heart muscle. It actually causes less pumping. You're going to have something called a ventricular septal defect, which means there's a hole between the left and the right in the ventricle, which is actually important because that's the only thing that keeps these kids alive, because it's able to mix the oxygenated and deoxygenated blood. Without that, if that was closed, they would never get oxygen.
But that hole's not supposed to be there.
It's not supposed to be there, but right now it's functioning for the moment.
Yeah.
And then the aorta, which is the big important one that leaves your left ventricle and pumps blood to your whole body, sort of is right there by where that septal defect is and comes up and over. So what this causes is cyanosis, so that blue skin, lips, nails, difficulty feeding, failure to thrive, so just not growing properly, and something they call TET spells. So tetralogy of Fallot. TET spells are these really cyanotic episodes triggered when the baby cries or is upset about something because, again, demand to the body is higher and it can't keep up with that. And the very textbook thing you're going to see in a question one day, if anyone's ever taking a question about this, is called tripoding. So these kids squat on the ground with their hands sort of in front of them. So like if you can like picture them in a little frog position on the ground with their hands in front of them, tripoding or squatting behavior, it's sort of, they kind of do that to help the pressures. Like they don't know they're doing it, but they're doing it because it helps everything to flow better and it helps to like sort of shunt the blood where it needs to go.
Yeah, you had mentioned something similar in an episode before where someone like gets into a certain position when they're having some sort of pain that like, I guess it helps whatever's going on.
Exactly. So basically, like we said, that large opening in the middle allows pressures to equalize and mix the blood a bit. And it's very complicated. It's very hard to describe this on a podcast. This is why I didn't want to do it on a double episode. But basically, yeah, I mean, so it essentially the bottom line is blood is not getting where it needs to get to your body. It's not getting oxygenated as easily. It's not pumping the oxygenated blood as easily to the rest of your body. So nowadays, like we said, you're catching this before birth most of the time if somebody's getting prenatal care. It's a lot better. You can, if you have a child who's going to be born with one of these defects, you now will then be giving birth in one of these centers in a big city because your doctors are going to refer you there, and you're going to have an induction where everything is very controlled and that baby's immediately going to be taken to the right places. Some of them will have like one surgery right after birth and another surgery months later, depending on what the situation is.
Is this a surgery they would do prenatally?
No. Yeah, there are certain things nowadays that they can do that way, but this is something they do wait until they're out because your blood is mixing, it doesn't matter when they're in utero, right? So their lungs aren't oxygenating then and everything is circulating. So it doesn't matter until after they're born. So yeah, it's surgical repair and the techniques, of course, have modernized and become even better. Typically, they're trying to do it somewhere by 4 to 8 months of age. They try and close that defect in the middle, and then they remove that obstruction where you can't get things to the lungs. That's the big stuff that needs to happen in order for things to flow better.
Would that be all in one surgery, or would they be separate surgeries?
Typically, it's one is the goal. I'm sure there are so many different techniques nowadays that there might be different theories that different centers use. I mean, there's going to still be risks, despite fixing it. You're still going to worry about these people as they get older, and they're going to have to try and keep their health the best they can because you don't want to complicate things. Your heart isn't perfect to begin with. We need to be very careful. Don't smoke. Try not to be overweight. Try not to have high cholesterol. Watching their blood pressure, watching their sugar, making sure everything else is under control because we don't want to set them up for more problems as they get older. And they would be more at risk of things like arrhythmias. So Arrhythmia is an abnormal heart rhythm. Your heart rhythm is determined by electricity. So it's actually like literally electricity through your heart muscle firing. And so when you got structural issues, things can get sort of messed up in that electrical signal. So they'd be more at risk of things like that. And they still will need to be followed, not just by your regular cardiologist, but somebody who specializes in an adult who's had a congenital heart defect. I have a patient with a different defect currently. And so like in New Jersey, she has to go to Deborah Heart and Lung Center because they're the only people who really have somebody, is probably in the whole state, who specializes in adults who are former congenital heart patients, because it's not super common, right? So there's not going to be many around. And people who live, even for my patient who has to drive a distance to get there, it's a big issue. In other states, they might have to cross state lines. They might have to drive 4 or 5 hours to find somebody who specializes in this as a baby or as an adult. So, the access, there's just not that many of these specialists out there. But in the end, it's pretty neat that this Vivien Thomas, how he literally, not a doctor, came up with the technique and was able to pioneer something that now literally saves thousands upon thousands upon thousands of lives every year.
Yeah.
And the movie was really nice. It's worth watching. It was a decent movie. Evie, my dog, is barking. She agrees.
Wait, so Mos Def plays Vivien Thomas?
Yes.
Okay.
Yes.
Because we got off on a tangent about his other
serious
movie.
Character. Like, I don't think of him, you know what I mean, as a serious, but he plays very well as a serious character. So he does a good job. And then Alan Rickman's the typical, serious guy or whatever. But it's well done. It's pretty historically accurate from what I can tell. And it's important to understand, again, they didn't know what they were doing. They were trying their best. And, not every child survived, but that child wouldn't have survived anyway. So they were doing what they could at the time until finally it was successful. And it was. And they practiced a lot in dogs.
Well, and I'm sure like the parents at that point knew like the risks and all that stuff. It's not like, oh yeah, we're going to fix your kid. And then they don't.
Right. That child wasn't going to make it more, I don't know the exact length, but we're talking 2-3 years old, and that would have probably been their life expectancy. So in order to get this done, gave them a chance. So yeah, it's a positive story for Heart Month as well as Black History Month. So I thought that was pretty neat. And if you did, I don't know if I put what episode of Sawbones it was, but they did cover it. I'm sure you can Google it. They did a nice episode about it. And then I did link, like, the American Heart Association has like some nice graphics on congenital heart defects, and Wikipedia has the story of that first patient, Eileen Saxon. So that's, and the visuals definitely help, because I know what I was describing was a little bit tricky. I mean, I'm moving my arms and doing things that nobody can see anyway, so that's not really helpful. But essentially getting the pipes going in the right direction, and being able to unconnect and reconnect things while keeping somebody alive. Nowadays, we have bypass machines. We have things that, ECMO and things that can be used. Back then, they didn't really have much. So It was pretty innovative for the time. And it's interesting. Like I said, congenital heart defects are something, like I said, I have one adult patient currently. Septal defects are a lot more common. So you will see those. So like between the top part of the heart, the atrium, or the ventricle, sometimes they don't know it at all. They live their whole life completely fine. Mm-hmm. Sometimes they will have what's called a patent ductus of futuriosis. This is a thing that's there in utero to mix the blood. It's like a little connection, and it's supposed to go away within hours to day after birth or so, and like close. Mm-hmm. Some people it doesn't close, so it's still patent. And they will go their whole life not knowing that until they have a stroke, because a little clot forms in there and throws off. But like they had no symptoms their whole life. And even on a regular echo, like an ultrasound of the heart, you wouldn't see it. They would only see it on something called a TEE, which is the one where they go down your esophagus. So
right.
Some of these smaller ones you really could live without knowing. But the really big ones, like tetralogy of Fallot and also the transposition of the great vessels, those are the really big ones that I need to make sure I remember everything for my boards. Those are those kind of life-threatening, needs to be dealt with. Sometimes you can have combos of two of these. We actually have somebody who's in the family whose child was born and they had multiple defects. And so they were born in New York at a tertiary type center. And then their team communicated with the specialist, the Mayo Clinic. So the child had one surgery in New York at a couple of months old. And then about 4 years old, they flew out to Minnesota and at the Mayo Clinic had the second stages of surgery done. And all of that communication nowadays was done like 3D images, telemedicine, them looking at like imaging of the heart, making a plan. It's amazing now what we can do. And so this specialist across the country is the one who's going to fix it. He's never even touched the child until they show up.
Yeah.
For that surgery. So we've come a long way.
Yeah.
We've come a very, very long way. 3D models, nowadays too, with eventually, right now we still use like artificial valves or we use pig valves or cow valves. But nowadays, I think we're going to be growing the stem cells, native valves, I'm sure, in labs, things like that, pieces that will eventually be able to help this that are made by actual human tissues. So we are really coming.
You need to cover Dr. Death, the one about the one
Paolo Macchiarini, the second Dr. Death. Yes, I know.
Not the first, the second.
Well, the first one was the spine surgery. Paolo Macchiarini. He's on my list.
I'm surprised they haven't done more because I'm sure there's many.
So there was like a documentary and there was a dramatization on him, right? There was both.
But Dr. Death is actually a podcast, so they covered the first one.
Started with the podcast.
So I'm surprised they haven't done. Or maybe they're still researching others because I'm sure there's other doctors out there.
I'm sure there are. But
Sadly.
That guy with his stem cells over plastic tracheas or whatever he was trying to do, craziest. Yeah, that's definitely one I want to cover at some point. And then other just like sort of transplanty stuff and stuff. There's so many crazy things that we can do nowadays.
Yeah.
That's very interesting.
We're saving lives, hopefully.
We are saving lives in other ways. We are not doing surgery.
No, I didn't mean I am not saving anyone's.
I am not doing surgery on anybody. You're saving people's mental health lives, which is important.
I'm trying.
And I am hopefully getting them all the preventive care so they don't have the problems, or I'm just yelling at them, telling them, it doesn't hurt me if you don't take your diabetes medicine. It only hurts you.
That is true. That is true.
Literally on Friday, I had to tell somebody, you are going to die from diabetes if you do not take this medication. And they were like, nope. I'm like,
yeah, that's not a fun
just
conversation.
So you know,
yeah.
I'm trying. It's not for me. It doesn't help me in any way.
Yeah.
I promise.
Yeah.
But that's us in the front lines, saving lives in different ways.
Well, and just like in my profession, you can't make the light bulb change itself. It has to want to change.
Exactly. The quote from Nicole. New t-shirt.
It probably wasn't even the right quote, but whatever.
Sounds good. Light bulb change itself. That sounds right. It's like
the light bulb has to want to change itself. Yes. How many psychologists does it take to change a light bulb? 0. That light bulb has to want to change itself. That's
yes. Quote that. Please write that down. These are all our t-shirt ideas that eventually one day we are going to remember and we are going to make a t-shirt.
I don't know who's going to wear or buy these t-shirts, but
what's funny is I was listening to MFM. It's their 10-year anniversary. And so they were talking about all the little quotes and things over the years that became things among their people.
Yeah. I do have a shirt from them. I don't know where it is. That's why I'm looking over there. It says, here's the thing. Fuck everyone. I have that shirt. And I have a fuck politeness shirt also.
Fuck politeness. That's one of their big quotes.
Yes.
So, we need our people. So people, tell your people to be our people. Come join the people.
Because we're all people. We could all be people together.
To name our people. Like they have murderinos.
Oh,
Morbid has weirdos.
We have alcoholics.
Not so anonymous.
Yes. Unanonymous alcoholics.
Yeah. We need to have a catch for our people.
Not AA, UA.
They're not mixers. They're not our
they can
flock.
be mixers.
They're our
flock.
Our flock.
That sounds like we have a cult, which I will be covering in a future episode.
So yeah, people, email us. Tell us what you want to be called.
They are our people.
Tell more people about us.
Look,
so that
no one has emailed yet. Nobody's going to email us and tell us what we should call them.
They need to go recruit friends. Okay, peeps. Go out there, recruit your people, tell them to listen to us.
Now we definitely sound like a cult.
Come join us.
Yes, we're an MLM where if you bring 5 people and then that person brings 5 people and then that person brings 5 people, you get a T-shirt that we haven't made yet that doesn't have a phrase on it because we don't know what you guys want to be called. That's what's going to happen.
I think that's a perfect ending for an episode. And drink all the blue drinks, people.
Yes.
Thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers. Shenanigans. Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon. Patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.